My name is Alisson Alvarado and I'm going to talk about antenatal betamethasone for women at risk for late preterm delivery. Definition: betamethasone steroid is a group of glucocorticoids that is used in medicine for its immunosuppressive and anti-inflammatory properties. Unlike other drugs with these effects, betamethasone doesn't cause water retention. Late preterm delivery. Infants who are born at 34 to 36 weeks of gestation, late preterm, are at greater risk for adverse respiratory and other outcomes than those born at 37 weeks of gestation or later. It's not known whether betamethasone administered to women at risk for late preterm delivery decreases the risk of neonatal morbidities. A study conducted a multi-center randomized trial involving women with a singleton pregnancy at 34 weeks 0 days to 36 weeks 5 days of gestation who were at high risk for delivery during the late preterm period, up to 36 weeks 6 days. The participants were assigned to receive 2 injections of betamethasone or matching placebo 24 hours apart. The primary outcome was a neonatal composite of treatment in the first 72 hours. The use of continuous positive airway pressure high-flow nasal cannula for at least 2 hours, supplemental oxygen with a fraction of inspired oxygen for at least 0.30 for at least 4 hours, extracorporeal membrane oxygenation or mechanical ventilation, or stillbirth or neonatal death within 72 hours after delivery.
Today we are going to talk about a clinical case. Contracting Susie came in at 1 a.m. this morning. She is a G3P. (0202) at 34 weeks 1 day, and her preterm deliveries were at 30. Upon evaluation, contracting every 2 to 3 minutes. I gave her antenatal. Yuppers, that is now. The antenatal late preterm steroids trial, published in the New England Journal of Medicine, was a large, multi-centered, randomized controlled trial that demonstrated benefit to the administration of antenatal betamethasone for pregnancies at birth. Thank goodness for level 1, because I sure know this is something I was wanting. Seemed like what made sense, and now we have the evidence evidence-based guidelines to support it. At the beginning of April, ACOG issued a practice advisory co-signing on the betamethasone from 34 weeks and 0 36 weeks and 6 days. So what were the findings? They noted decreases in respiratory and decreased use of postnatal increase in the proportion of prolonged NICU stays. There was no adverse outcomes such as sepsis and chorea. Hypoglycemia was more common in infants exposed to beta. Not correlate with any adverse events or stays. Essentially, blood glucose monitor recommended in infants in that gestational age. Or some of you go overboard. Here are a couple things that we should not be doing. At 34 to 36 weeks, do not tokalize or keep sick people.
Results. The primary outcome occurred in 165 of 1,427 infants, that's 11.6% in the betamethasone group, and 202 of 1,400, that is 14.4% in the placebo group. Severe respiratory complications, transient tachypnea of the newborn, surfactant use, and bronchopulmonary dysplasia also occur significantly less frequently in the betamethasone group. There were no significant between-group differences in the incidence of chorioamnionitis or neonatal sepsis. Neonatal hypoglycemia was more common in the betamethasone group than in the placebo group.
Doctors have prescribed steroids to pregnant women at risk of preterm delivery for decades. But what about those at risk of late preterm delivery? I'm Shelby Cullinan with your latest health news. In preterm delivery, or delivery before 34 weeks of pregnancy, can be lethal. Doctors often prescribe corticosteroids because these drugs can accelerate an unborn baby's lung development. But in women at risk of late preterm delivery or delivery between 34 and 36 weeks, steroid prescriptions are much less common, likely because babies delivered at this stage have much higher rates than babies delivered earlier, according to a University Medical Center, have increased rates of compared to babies born at term, or according to this study. That's where pregnant women at risk of late preterm delivery could step in. In a press release, quote, "Our study demonstrates a medication that is commonly used to prevent complications in babies born before 34 weeks of gestation also reduce the risk of many serious complications in babies delivered just a few weeks before term. Speak to your doctor about the benefits of steroid prescriptions."
Conclusion. Administration of betamethasone to women at risk for late preterm delivery significantly reduced the rate of neonatal respiratory complications. Here's the last video. Enjoy it.
I'm an OBGYN resident from Christiana Hospital, and welcome to this week's episode of Pocket Pearls. Welcome to this week's episode of Pocket Pearls. Due to the realization that infants born in the late term period have worse outcomes than infants born after. There was a joint workshop in 2005 to direct research efforts to evaluate the outcomes of the preterm period. From that effort came the publication in the New England Journal in 2006 titled Antenatal Betamethasone for Women at Risk for Late Preterm Delivery.
Of those neonates. Who was included in this?
Women between 34 weeks
Of delivery. The authors had multiple criteria for what they considered a high likelihood of delivery. High likelihood of delivery as either preterm membranes and at least 3 centimeters
Dilated or at least 75%
dilation or
effacement,
75
or spontaneous rupture of membranes.
section between 24 hours and 7 days after the randomization.
Thank you for watching.